This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. And as you know, October is Breast Cancer Awareness Month. And we wanted to talk about breast cancer, some of the signs, some of the symptoms, some of the treatment. We're going to be talking with Christina Mintner, who's the Senior Vice President of Population Health and Homes at Parkland Health and Hospital System. Christina, welcome to the show.
Thank you, Steve. I'm delighted to be here.
You know, Christina, when you think in terms of breast cancer, in your opinion, what's a woman's risk of getting breast cancer?
Well, a woman's risk of breast cancer is 1 in 8 in their lifetime. So 1 in 8 women in their lifetime will be affected with breast cancer. And other than skin cancer, breast cancer is the most common cancer among American women. Most breast cancer is found in women who are 50 years or older.
Are you at greater risk if you have differences as far as you mentioned age, but what about ethnicity?
Well, the majority of women in the United States who have breast cancer are white and Asian. However, after adjusting for the socioeconomic status, racial disparities in breast cancer still persist in the United States. So Black women are more likely to have late-stage cancer and larger tumors when they are diagnosed, and they also have the highest incidence of breast cancer among women under 40 and are most likely to die from breast cancer at any age. So we still have a ways to go to reduce the disparity in breast cancer.
You know, I know you work in the population health and homes at Parkland Health and Hospital System, and you reach into many of the communities where the social drivers of health impact them. Is that a group that you would say is at higher risk, as you indicated, because of their socioeconomic condition?
So I know this is something that you have talked about, and it's something that a lot of people are focusing on, these social determinants of health. And when we looked at our community health needs assessment that Parkland and Dallas County did in 2019, we saw that somebody's zip code should not determine their health status, but that's actually what's happening, not just in Dallas County, but across the United States. And studies have shown that people living in low-income zip codes have a lower life expectancy than those in higher-income zip codes. And those health disparities are due to complex interplay of racial, economic, educational, and other social factors like lack of access to food, transportation, access to health care. So I would say, yes, looking at some of these social determinants of health also impacts negatively someone's health risk.
You know, for women, what are some of the warning signs, or what are some of the symptoms that they should be watching for related to breast cancer?
So when people think about breast cancer detection, they usually think about finding a lump in one of their breasts. And a lump is certainly a possible sign of breast cancer, but it isn't the only one. And it may not even be the first one to develop. So a change in your breast may be an early sign of breast cancer. And some of the things to look for is a new lump in the breast or your underarm or your armpit, changes in the skin of the breast, redness or flaky skin in the nipple area or the breast, thickening or swelling in your breast, nipple discharge, which could be bloody or clear, nipple pain or breast pain, even an inversion, which is a pulling in of your nipple. And I think what's important to remember is that mammograms are only once a year, so women have to really know their bodies and be alert to any changes in their breasts. And if they have any of those signs that I just mentioned, they need to see their doctor right away.
You know, for young women especially, as they're becoming adolescent and then becoming young women, even though, at that point they may be 20, 21 years of age, would you recommend that they do self-exams, especially looking for lumps in their breasts?
I absolutely think that women should start self-exams as early as possible, because then they will notice if they have any changes. So again, getting to know your body and being alerted to any changes that they have is one of the best things that you can do.
Are there things women can do to help lower the risk of breast cancer? You said 1 in 8 women. Are there things you can do to try to help prevent breast cancer?
Most certainly. I mean, keeping a healthy weight for those who are overweight or obese, losing even a small amount of weight has health benefits, and that's a good place to start. Engaging in regular exercise is another way to lower your risk of developing breast cancer. If you drink alcohol, limit the amount you drink, so no more than 1 drink per day for women or 2 per day for men. I mean, if you do have a family history of breast cancer, if you have the BRCA1 or BRCA2 genes, which are the breast cancer genes, and certainly talk to your doctor about other ways that you could lower. But really just staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving if it does occur. And of course, being preventive and having those mammograms annually.
You know, Christina, you've given some good points related to diet, exercise, etc. But even then, sometimes women obviously have breast cancer. Any thoughts on that?
Well, Steve, as you know, I am a breast cancer survivor, and I felt that I was doing all the right things that I mentioned earlier. I was at a healthy weight. I exercised. I've been, a lifelong vegetarian. And so I had my mammogram that year, and it had gone well. And then about 5 months later, I noticed a lump in my breast, and I disregarded it. And then about 2 weeks after that, my breast became noticeably larger. My left breast did, and that's when I knew something was wrong. And I had done everything like I was supposed to, and I still got breast cancer. The point is yes, anybody can get it, even if they're living by the books. I mean, cancer doesn't discriminate. That's the most important thing to remember. It doesn't discriminate. It can take anyone. And that even though I'd had a mammogram that year, in the same year, I still got breast cancer. And so that's why it's so important to know your body and to know when there are changes. Because when I felt that lump, and I just disregarded it because women do get lumpy breasts, but then 2 weeks later, when it was noticeably a different size, I should have said something. But sometimes as women, we're busy, we have other priorities, we don't want to bother a doctor with something like lumpy breast, but really I should have gone in when I had first noticed it instead of waiting, a couple more weeks after that. And the other thing I just want to point out is that, I work in healthcare, but being diagnosed with any type of cancer is a game changer. And so one of the things that we have at Parkland is patient navigators. And cancer is just so complex, and breast cancer involves so many specialties, as most of the cancers do. And so having a navigator to help you transition between the specialties helps to really reduce that fragmentation of care that you could get. And it also helps give you kind of putting it in somebody else's hand, because when you're first diagnosed, it's just so incredibly overwhelming. And so navigation is really a critical component to ensure the process is as seamless as possible for the patient.
October is Breast Cancer Awareness Month, and we're talking with Christina Mintner from Parkland Health. Janet St. James joins us next week with an update on her health, and all of these interviews are on our podcast and our YouTube channel, The Human Side of Healthcare. Christina has been a survivor for 7 years. More of her story next. Stay with us.
This is The Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back to the show. We're going to continue our discussion with my good friend, Christina Mintner from Parkland Health. Christina has been a breast cancer survivor for approximately 7 years. Hey, can you tell us a little bit and help our listeners know a little more about the Moody Center for Breast Health?
Absolutely. So our Moody Outpatient Center opened in 2021, and it truly marked a new chapter for Parkland's cancer program. cancer care is often perceived only as a treatment of cancer patients rather than the care along the whole cancer continuum. And so this could result in fragmented care. And so at Parkland, we look at the entire continuum from prevention, like getting those screenings and mammograms, to survivorship. And that's really our foundation. And so when we moved into the Moody Outpatient Clinic, the space allowed us for that multidisciplinary care integration, as well as growth for our program and a better environment for our patients. So on the first floor of the outpatient clinic, we have the Moody Center for Breast Health, and it includes our breast imaging and the breast clinic. And our breast imaging center provides a full range of breast screening and diagnostic services in one location. So that includes the mammograms, the ultrasound, the MRIs, the biopsies, the stereotactic core biopsies, and then, of course, the most advanced technology with the 3D mammograms. And this is just really important to have all that there for our patients so that they're screened in a comfortable and calm environment. And then connected to the breast imaging is our breast clinic, which has our breast surgery and breast oncology providers, and also other members of the patient's care team, which might include genetic counselors, dietitians, social workers, financial counselors, and navigators that I mentioned earlier. And so this is that multidisciplinary care that Moody has, the Moody Breast Center. And then on the third floor, we have our infusions. We have 51 bays. We also have a cancer resource center that includes a health library with patient education materials and classes and support groups. We have a women's boutique that provides assistance with mastectomy, bras, prosthetic, compression garments, and wigs. And then we also have a rehab gym, and we have certified lymphedema therapists to support patients during and after their treatment. And one of the things that I'd just like to focus on a little bit more is the survivorship, because that's an area that I think is often overlooked in cancer care, and I'm so happy that we have this at Parkland. And again, speaking from my personal experience, when you are going through your treatment, there's just a lot. You have a lot of doctor's appointments, you have a lot of labs and imaging, and just you have a lot of people around you helping to support you. And then when the treatment is over and you're a survivor, it's kind of like, now what? And I think that that's a time that's often overlooked, but it's actually, at least for me, it's still, it was a difficult time in my life, because it was kind of like, well, now my treatment is done, and I'm very happy my treatment's done, but you still have a lot of emotions tied to it, a lot of fear of reoccurrence. What do I do with my life now? And so having a program that links women with other women who have gone through it, or provides resources for financial or possibly body issues or sexual health issues, is really important for the journey of the cancer patient, because the treatment can have late and long-term side effects. And so the cancer or the survivorship care is just as important as the rest of the program.
You know, Christina, thank you so much for pointing that out. You know, I'm a cancer survivor too, with prostate cancer, and you're so right. When the treatment is over, you still have that period of anxiety. Is it going to reoccur? How are things going to be? So I am so glad you pointed out the stage of survivorship and how that's an integral part of the overall continuum of care. You know, Christina, you've done a great job. Thomas may have some questions, but before he does, let me ask you one final question. Christina, to our listeners out there, do you have any nugget of knowledge that you want to share with them about breast cancer, or anything that you want to at least kind of have the last word with them?
Yes, I would like to say to any woman who has just been diagnosed or is going through treatment that you are stronger than you think you are, and that you will get through this. And there is a huge support of survivors who will help you get through it. But it's going to be tough, it's going to be hard, but you are stronger than you think.
What a great final word. That was fantastic. Thomas, I'll turn it over to you.
Thanks, Steve. Christina, let's go back to when you got that diagnosis. You said you waited a couple of weeks.
Mm-hmm.
What were some of your thoughts to yourself?
I think my first thought, my first thought was, of course, shock. But after that, it was, why me? And that was for a while, I would say, because I had done everything right. I felt I had done everything right, and I felt, kind of cheated. Like I maintained a healthy weight, I was active, I ate well, why did this happen to me? And I think after a while, I came to the realization of, well, why not me? I'm not any different than anyone else, so why not me?
And then what was your next step?
Well, my next step is something that I would advise no one to do, and that is to start Googling breast cancer, because you need to listen to your doctors. There's a lot of misinformation out there, and I was lucky that I had amazing doctors who are still part of my life today, who also reminded me not to look up Dr. Google.
And this was quite a while ago, correct? You've been a survivor for how long?
I was diagnosed at December in 2015, and I started my treatment in 16 and finished everything in 17. So yes, a survivor since 2017.
5 years.
Yes.
Awesome. High five.
High five.
That is great. Wow.
Thank you.
So thrilled for you. What were some of the keys? Like when you talk to women now who are going through what you completed, what do you tell them?
To rely on their support system, to rely on their friends and their family, because it's going to be tough. And if there are people who want to help you, then let them help you. Everything kind of takes a back seat when you're diagnosed with cancer. Like I said, it is a game changer, and it puts so much into perspective for you, and you learn to slow down. And some of those things you should have been doing before, but life gets so busy. So I think what's important is to let others take care of you, and just to know that it will get better. There is light at the end, and one day, the impact or the effects of chemo can last a while. But honestly, for me, one day I just woke up and I was like, I feel better. I don't know what it is. I don't know what happened, but today I feel better.
That's just awesome. That is so cool. Cancer used to be the equivalent of almost a death sentence when you heard those words. And today, in 2022, not so much, on a lot of different fronts and for many different reasons. The technology has advanced so much that now it really almost is kind of like a journey that you go through, but there is tremendous hope on the other side because of what we can do now. Isn't that true? Do you see that at the Moody Center as well?
It absolutely is true. I mean, medical advances have been remarkable in the past decades, and cancer patients as a whole are living much longer as a survivor, and it's not what it used to be. I mean, people are living through cancer, and that's remarkable. Early detection is still key, though. So not skipping those annual mammograms, not waiting when you see a change in your breast. So early detection is still key, but we have such better treatment options now and better detection.
With this being October Breast Cancer Awareness Month, what should women be focusing on this month specifically? What should hit their awareness as they're listening to this so that they take action?
If there's one thing that you can do during October, it's schedule your mammogram. The National Comprehensive Cancer Network recommends annual screening mammograms starting at age 40 years for all average risk women.
So 40 and over.
40 and over.
Take action.
Yes.
Steve, we've been talking about somebody you know well, Christina Mintner from Parkland Health, about her journey in cancer.
You're absolutely right, Thomas, and what a remarkable person. And I'll share a personal story with you. I have such respect for Christina and how she handled her initial diagnosis that I was diagnosed about 5 years ago with prostate cancer. She was one of the first people I called. I had lunch with her and told her I hoped I could handle my cancer experience the way she had handled hers. That's right, and we hope it'll continue. Her prognosis looks very good, and mine does as well, and we're very thankful. And she gave us great advice today for all people, especially women, but also men. If you see something and something doesn't feel right, don't wait. Make sure you get it checked out.
Wow, that's quite a testimony. And now both of you, longtime survivors of both of those diseases.
That's right, and we hope it'll continue. Her prognosis looks very good, and mine does as well, and we're very thankful. And she gave us great advice today for all people, especially women, but also men. If you see something and something doesn't feel right, don't wait. Make sure you get it checked out.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. Delighted you're with us today. And we want to continue discussions related to stress, anxiety, how it affects kids and adolescents, and also adults. We're delighted we've got Dr. Dante Burgos back with us. He's the medical director at Medical City McKinney for Behavioral Health Services. Dr. Burgos, welcome to the show.
Thank you for having me back.
As we look to the school year, school's already begun. Kids are under a lot of stress and anxiety. What are you seeing that kids are experiencing today?
Well, the challenges for kids of today are really a magnification of past challenges. The idea of separation anxiety disorder, school phobia has been around with us for a very long time. And now more than ever, emerging from COVID and having kids come back into the school setting, many of those symptoms have been magnified. So kids that are going back to school are stressed over the fact that they are being separated from their family. They've been used to being at home with mom or dad, depending on the situation, of how that family handled COVID-related education. And then a little bit of a layer on top of that has been feelings and concerns about safety going back to school, especially with all the news that we've seen related to gun violence in the school setting and how school systems are scrambling to try to put folks at ease. But that hasn't really been accomplished just yet. And so a lot of anxiety is manifesting in our children and adolescents today.
So what is your advice to parents then, as children are worried about their safety, as you indicated, gun violence, the anxiety and stress of now returning to school? What are some helpful tips for parents?
Yeah, I think that, the main thing for parents to reassure their kids on is that they're doing what they can to make absolutely sure that things are going to be safe for them as they transition back into the school setting. Improve communication with school personnel and educators has certainly been ramped up, and kids need to hear that their parents are more actively involved, and in establishing systems where they're checking in with each other a little bit more. A lot of times what we want to do is we want to turn what can sometimes be irrational fears into more realistic anxieties, which then can be managed with simple safety measures. And so we always talk about how to help communicate with your kids what your own anxieties are and what theirs are, and then to really come up with a list of how to help overcome those anxieties. And so improve communication, again, being able to have a safety plan in place, involving certain contingencies. All of those things will put them more at ease about how to handle any future concerns.
Great advice. Let me ask you this. I was talking to a parent the other day, and they knew that their adolescent was being bullied online, had become withdrawn, and actually started doing some self-harm. So they immediately called, and they had to wait 60 to 90 days to even get an appointment. We know there's a real shortage of mental health workers, and being able to treat children and adults. What is your advice when those kind of situations arise, but you're not getting medical help as quickly as you think you should?
Yeah, so I think that with regards to accessing a mental health professional, when I hear 90-day waits and beyond, that certainly has been the case with psychiatrists, with MD psychiatrists. But as relates to accessing counselors and therapists, if you're getting those kinds of responses that it's going to be a 90-day wait list, there are certainly resources that are now open. Much more we're using telehealth and telepsychiatry services, which can give you much more immediate access. A high degree of the insurance providers for families that have insurance are now giving that option. Much of that came about because of COVID, but has remained in place and will actually probably be a permanent option for us. And so there's always going down those roads. But if you're not able to get that access to a professional immediately, always keep in mind that the church that you may belong to is another resource for you. And then the mental health center system can at least initiate an intake process. And many of those clinics are walk-in services. So that's something to keep in mind as well.
We're talking with Dr. Dante Burgos here on the Human Side of Healthcare program. He's the medical director at Medical City McKinney Behavioral Health Services. We've been talking about some of the challenges our kids are having going back to school. Now we're going to shift to us adults.
You know, adults are having to deal with the stress of their kids, as we indicated, going back to school. But adults are looking at inflation. They're looking at jobs. They're looking at supply chain issues. What tips do you have for adults to manage these pressures?
Well, that's a great question, and we could probably spend an hour on that alone. I think that adults, and I think about my own experience in dealing with the here and now, we really have to look at what are the things that we can control and what are the things that we cannot control in our life. So, when I see a statistic about the inflation rate or an impending recession or supply chain issues, I have to accept that in the macro of things, I may not be able to do much about those kinds of events. But what I can do in the here and now is focus on my own self-care. First of all, I need to take care of my nutrition, my sleep patterns, health overall, and then do all that I can to make sure that my job is stable. I did read a very interesting article about how folks that have been laid off from work are finding jobs relatively quickly. And so it's good to know that the environment, although it's very fluid, there are still opportunities. So we have to focus on the things that we can do to take care of ourselves, accessing resources, whether it be in our work environment, human resources, et cetera. Those are always opportunities for us to stabilize any of our own anxiety and then being able to share that with friends and family so that we can kind of get through these crises together.
Great advice. And I know that adults face a lot of pressure. As you know, in the work you do, adolescents and adults, unfortunately, suicide and attempted suicide is continuing to increase. Do you have any advice to people related to if they suspect a family member or friend is really having suicidal thoughts?
Sure. Well, you briefly touched on it earlier. I think that whenever we see a change in behavior, and obviously the first sign is a child that is all of a sudden beginning to withdraw and isolate, that certainly is a red flag to really explore what's going on with that child. Access to social media, that cell phone can sometimes be, sadly, a gateway for bullying and other things to happen. So when you see those warning signs, you certainly want to reach out to that child and let them know that you are there for them. A lot of times families that struggle with children and adolescents that are having thoughts of hopelessness or helplessness, those parents have gone through that same dynamic. Remember, major depressive disorder is often strongly rooted in some genetics. And then you put on top of that some learned behaviors where maybe parents haven't handled situations the best way that they could have, whether it's through self-medicating with alcohol or other substances. And that sets up, unfortunately, a poor role model for those children and adolescents. So again, after we've done what we can to take care of ourselves and really model the right way to handle stress and depression. We want to offer that to our children, always through improved communication.
You know, when we think in terms of behavioral health and we think in terms of stress and anxiety, I'd be remiss if I didn't touch on something that is very problematic in our society. It's throughout the society. You see it in politics, and that's polarization. How do you, as a professional, define polarization?
Well, I mean, for me, polarization, unfortunately, develops when we as individuals start to lose the capacity for empathy. I may have an opinion that differs from yours, and yet we get so emotionally caught up in defending our position or viewpoint that it comes at the expense of damaging the relationship. I always remind people that we have so much more in common with each other than not, but that seems to get forgotten in the heat of the moment. So with regards to polarization, I try to focus on basic rules of communication. It's okay to agree to disagree, but to be respectful and understand as best as you can the position that the other side is coming from. And with that, then you can begin to shift the dialogue back towards ways of trying to find commonalities and likenesses that allow the relationship to remain intact.
This is Dr. Dante Burgos, the medical director at Medical City McKinney Behavioral Health Services, obviously talking about some of the challenges that North Texas families, kids, and their parents have been dealing with this fall in going back to school. We'd also like to remind you of our podcast where all of these interviews are, this one in its entirety, and Christina's about breast cancer. Check The Human Side of Healthcare on your favorite podcast player or on YouTube. More wisdom from Dante Burgos next on The Human Side of Healthcare.
Covering the healthcare topics that matter most to North Texas. This is The Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're continuing this very important and engaging conversation with Dr. Dante Burgos from Medical City McKinney about some of the challenges North Texas families are going through as we go back to school and the uncertainties of these times. Steve?
So as you look at children, adolescents, and adults, you've touched on it, but are there any other nuggets of what your advice would be on dealing with polarization?
Well, the answer is not going to be an easy one for a lot of folks to hear, but they're pretty basic. One is that we must model our behaviors for our children. And unfortunately, there are many voices out there competing for that child's attention. And sometimes difficult decisions might include limiting exposure to certain aspects of social media that seem to promote negative thinking and negative behaviors. So we have to model appropriate behavior. There's nothing stronger for a child than to see two parents disagree or dad and Uncle Bill disagreeing, and yet being okay with the disagreement and still being very close and still caring for each other. And so modeling is the most important thing, but you have to make sure that you're the primary focus. And sometimes that means limiting access to some of those negative influences in their life.
Dr. Burgos, this is Thomas. I'm just curious, and this is a personal opinion question, not something based on scientific research by any means. This is just asking you your thoughts. If we had another similar kind of situation to Uvalde, from everything that you see, read, hear, and talk to patients in your office, how close do you think to a snapping point we are culturally?
You're right. This is going to be a personal opinion. I think that communities like Uvalde, there have been so many examples, sadly, in the last few years. A lot of times the community determines how things will go. When you see close-knit communities that all come together and don't really go into a blaming. They shift into that kind of a mode. Those communities really struggle, and the risk of unraveling is very high. And so I think that if we can continue to remember that we are all spiritual beings, that we all have the same hurts, the same anxieties, the same wants, and that we can, again, show empathy for each other, we can keep it together. We must keep it together. And I really believe that if we continue to use our faith and our spirituality, we can overcome these crises while we wait for our leaders to help us with solutions so that this doesn't happen.
You know, we talked about spirituality when you were on a couple of weeks ago, and we have to make it relevant for our kids, right?
Yes, we do, and it absolutely has to be at an age appropriate level of communication so that they can grasp that. But to say that you care for someone and that you want the best for your fellow human being, that transcends any specific religion, or creed. I think it really just speaks to the human experience, and that we all want the best for each other. When one does well, we all do well, and when one is suffering, we want to lift them up.
You and Steve talked about job security and the importance of that in the overall well-being of our psychological composition. And we're living in uncertain times. Do you think this is a time when adding a second or third income even might be something that people should consider?
Absolutely. That's the and that's actually been the way it is. It's funny watching my son graduate from college, and he's one of these techie types. So he does a lot of coding and internet based work, and he has in his short professional career jumped jobs 3 and 4 times, and in my day, the sign of a good employee was someone that was loyal to a company, that had been there, with longevity. And now that has really flipped on itself. It's almost like the idea that you have 2, 3, or 4 jobs that have come about because you're in demand. That's the attractive part of the work environment. So it really has, it's caused me to kind of shift my perspective on what job stability means. Unfortunately, it does seem to mean that you always want to be looking a little bit at what your next step is. And, the idea that you don't want to put all your ducks in one pond is very much the reality.
I wanted to go back on the suicide point that you and Steve talked about. So from your perspective, and I know you keep your eye on the data, are the numbers going up in that area?
Well, what we're looking at is that adolescent and young adult suicide is ticking up for sure. But of more alarm is the fact that suicide attempts and self-harming behavior are starting to occur younger and younger, and it's now going into pre-adolescence. So you start establishing a baseline of a population that has already experienced some self-harming behavior, so that as they enter adolescence, the risk for them to actually attempt a more serious suicidal gesture is higher. So it just speaks to how much more we have to be vigilant in watching how our kids are doing.
Okay, and on that very point, are kids able to mask their emotions so that they can hide that feeling inside from their parents and then just all of a sudden go off one day and their parents are completely caught flat-footed?
Yes, that does happen. And I think that what we have to, it's very nuanced. If someone is masking their emotions, the question is, have they always been of that personality type, or is that a new development? And so for me, masking emotions is a little bit of a withdrawing from the family, and that's a change that has to be picked up within the family system. And sometimes it's pretty imperceptible, but we have to be vigilant to make sure that there isn't anything like that going on. I can't tell you about how many times I've had parents come to me saying that they did not have any idea that their child was in trouble, but that a parent of another friend reached out to them after something was posted on social media. So we as parents have to stay as vigilant as we can with our children. That's why the little things like dinner around the table, sitting around the dinner table, going on, a weekend picnic together, that time together is crucial for them to have the comfort level to then be able to share what's really going on with that inner state that our children go through.
And it doesn't matter young or old. When we go through a challenge, one of our natural inclinations is to push away.
Yes.
We don't want all the involvement. We don't want to answer phone calls. We don't want to look at emails. We want to push all that stuff out.
You're right. And in the beginning, that's not a bad thing. You're confronted with something and you say, okay, let me just kind of circle the wagon here for a little bit so that I can kind of see, identify what the problem is and try to address that. The challenge is that when that then becomes overwhelming and you've pushed those folks away and you don't turn around and ask them, hey, I'm in trouble here. I need a little bit of help. I need your insight on this, or I'm struggling over here, and then really kind of call the cavalry back, so to speak.
And Dr. Burgos, I do want to end this kind of on a real positive note. I think you would certainly agree, as the professional you are, if someone is having problems, family or friends, there should be no stigma associated with seeking professional help, because good behavioral health is an overall part of good health in total. Would you agree?
Oh, absolutely. Those days are gone, in my opinion, or sure need to be, because there's clear evidence. I mean, the brain is an organ just like the heart or the stomach or the liver. We pay attention to all of those. The brain is the most important one. So mental health is a medical condition, and we cannot ignore the focus on nipping any of those symptoms in the bud and staying at our best.
Dr. Dante Burgos, Medical Director from Medical City Behavioral Health Services. Great to have you back on the human side of healthcare. Steve?
Great advice we heard, Thomas. Folks, we want you well this fall, so please talk to your provider or pharmacist about getting your flu shot. Join us next week on the human side of healthcare.